Hi, I'm Dr. Jocelyn. I'm about to show you something that could lower your blood pressure 10, 15, even 20 points, starting with your very next meal. Most doctors won't tell you this because it's not about pills. It's about the order you eat your food. One simple shift, eating vegetables first, can calm blood sugar spikes, relax your blood vessels, and work faster than most medications. If you're over 50 and want to protect your heart, stay with me. I'm going to show you exactly how to do it. There's something you can do with your very next meal that could lower your blood pressure by 10, 15, even 20 points in just a few hours. Most doctors will never mention this, but after years of working with older adults, I've watched perfectly healthy seniors develop high blood pressure, not because they needed more medications, but because nobody ever taught them 5 simple food strategies that change how their body responds. These aren't exotic superfoods or expensive supplements. I'm talking about regular foods you can start using today. And research in major medical journals proves these strategies can work faster than most prescription drugs. What I'm sharing goes against what you've been told about controlling blood pressure. Big pharmaceutical companies don't want you to know this, and most doctors simply weren't taught these connections in school. But I've seen it with my own eyes, patient after patient, blood pressure reading after reading, and I refuse to stay silent any longer. By the end of this video, you'll know 5 powerful ways to lower your blood pressure, why they're especially effective after age 60, and how to implement them starting with your very next meal. The first strategy has the most immediate effect, and you're probably doing it wrong at every meal. It's not about what you eat, it's about the order you eat it in. Changing this one thing could drop your blood pressure more than adding another medication. Let me tell you about Thomas, a 68-year-old patient whose blood pressure was 165/95, despite taking 3 medications. His doctor wanted to add a 4th, but Thomas was already struggling with fatigue and dizziness from his current pills. The thought of another drug felt like surrendering to a life he didn't want. Thomas came to me desperate for alternatives. I asked him to describe a typical meal. He would eat a little chicken, then some rice, then broccoli, switching back and forth, just like most people do. The problem wasn't what he was eating, it was the order. I gave him one instruction: eat all your vegetables first, completely finish them before touching protein or carbohydrates, then eat your protein and finally eat carbs. Thomas looked at me like I was crazy. How could the order matter? But he was willing to try anything. 2 weeks later, Thomas called me excited. "Dr. Jocelyn, my readings are lower. I haven't seen numbers like this in months." 4 weeks later, his systolic pressure dropped 12 points. 8 weeks later, it was down 18. We eliminated one of his medications. 6 months later, he was on 2 drugs instead of 3, with his blood pressure steady at 132/78. Here's why it works. Eating vegetables first fills your stomach with fiber-rich, water-dense food. That fiber forms a barrier that slows digestion. Protein and carbs have to pass through it, slowing glucose absorption and preventing the rapid blood sugar spike that triggers blood pressure elevation. Picture it like a filter. Vegetables first, everything else passes through slowly and gently. Blood sugar doesn't spike, insulin stays steady, and your blood pressure remains stable. Vegetables also provide potassium, magnesium, and nitrates, which relax blood vessels, help your kidneys excrete excess sodium, and trigger hormones that regulate blood pressure. Research shows eating vegetables first can lower post-meal blood pressure by 8 to 12 points, sometimes even 15 to 20, without changing your foods or calories. Timing is everything. If vegetables are mixed with other foods, the effect disappears. Carbs first, the spike is unavoidable. Start asking yourself, am I willing to change the order I eat my food if it could lower my blood pressure by 10 to 20 points? It's simple, effective, and safe. Raw or cooked doesn't matter. Spinach, broccoli, green beans, cauliflower, asparagus, Brussels sprouts. Finish them first, then move on. Consistency at every meal is the golden rule for maximum benefit. Now, let's move to the second strategy, and this one might surprise you because it involves something you probably think is only for salads. It's something acidic that you can add to your food or drink, something used for thousands of years but largely ignored by modern medicine. Yet research shows it can lower blood pressure as effectively as some prescription medications. Millions of people have it sitting in their kitchens right now, completely unaware of its power. Take Margaret, for example. She's 72, and her blood pressure was consistently 158/92 despite taking 2 medications. She followed every recommendation from her doctor: low-sodium diet, daily walks, stress reduction, but nothing kept her systolic under 150. Her cardiologist even discussed adding a third medication. Margaret already felt dizzy from her current prescriptions. Another pill felt overwhelming. When she came to me, she wanted something natural, something she could actually do herself. I told her about a simple intervention. Add 1 to 2 tablespoons of apple cider vinegar to water or food 3 times a day with meals. She was skeptical. One simple ingredient for blood pressure, but she had nothing to lose. 2 weeks later, Margaret's home readings started dropping. 152, then 148, then 144. 4 weeks later, her average was 138/84. 8 weeks later, 132/78. We didn't need that third medication at all. Her cardiologist was amazed. How does vinegar work? The key is acetic acid, which has multiple effects at once. First, it slows the release of food from your stomach into the intestines. This prevents the rapid blood sugar spike that usually raises blood pressure after meals. Second, acetic acid improves insulin sensitivity, meaning your cells respond better to insulin. Less insulin means less sodium retention and less blood vessel constriction, lowering blood pressure. Third, vinegar increases nitric oxide production in your blood vessels. Nitric oxide signals blood vessels to relax and widen, making blood flow easier and pressure lower. But that's not all. Vinegar also activates an enzyme that helps regulate blood pressure and metabolism, reduces inflammation in blood vessel walls, and improves endothelial function, the inner lining of your blood vessels that controls dilation. Studies in the European Journal of Clinical Nutrition show that 2 tablespoons of vinegar with a high-carb meal can lower post-meal blood pressure by 6 to 8 points, with some people seeing drops of 12 to 15 points. The effect depends on the dose. 1 teaspoon helps, but 2 tablespoons works even better. Here's the catch. Most people use tiny amounts in salad dressing and think that's enough. It's not. You need 1 to 2 tablespoons with each meal, 3 times daily, every day. Always dilute it. Never drink vinegar straight. Straight vinegar can damage tooth enamel and irritate your esophagus. Mix it in water or add it to food, and make sure you're consistent. If you're still taking blood pressure medication but your numbers remain high, vinegar could be the missing piece. Talk to your doctor and ask, can I try adding apple cider vinegar 1 to 2 tablespoons 3 times daily and monitor my blood pressure? Most physicians support nutritional interventions when backed by research, and in this case, the evidence is strong. Once you start, track your readings. Within weeks, you may see real changes, and this simple habit could prevent the need for additional medications while giving your body natural support. It's inexpensive, safe, and incredibly effective. Next, we'll look at a strategy that works specifically at night while you sleep, targeting silent spikes that most people don't even realize are happening. This third strategy is simple, natural, and perfect for seniors concerned about cardiovascular health. Now, let's talk about the third strategy, and this one is especially important because it targets a hidden blood pressure problem that almost nobody realizes they have. It's a nighttime strategy. Something you do specifically before bed, not in the morning or at lunch. It addresses blood pressure spikes that occur while you're sleeping. These nighttime spikes are silent, invisible, and far more dangerous than daytime high blood pressure. Let me share Robert's story. He's 70, a retired teacher, and his daytime readings seemed fine, around 135/82, but he didn't feel right. He often woke up with headaches, feeling groggy, even exhausted despite sleeping well. His doctor said his blood pressure was okay based on office readings, but something didn't add up. I asked him to wear a 24-hour blood pressure monitor, and the results were eye-opening. During the day, Robert's pressure was normal, but at night it spiked to 165/95, sometimes even higher. For 8 hours every night, his blood vessels were under significant stress, and he had no idea. This condition is called nocturnal hypertension, and it's extremely dangerous. Nighttime blood pressure predicts stroke risk better than daytime readings, yet it often goes undetected because most people only check their numbers during the day. Robert's doctor considered adding a nighttime medication, but I suggested trying something simple first. I recommended that Robert eat a handful of walnuts about 30 minutes before bed every single night. He agreed to try it. 2 weeks later, we repeated the 24-hour monitor. His nighttime blood pressure had dropped to 142/86. 4 weeks later, another monitor showed 135/80 at night. The dangerous spikes were gone, and no new medication was needed. Why walnuts? They're incredibly rich in alpha-linolenic acid, a plant-based omega-3 fatty acid that your body absorbs and processes while you sleep. This improves endothelial function overnight, increasing nitric oxide production and reducing inflammation in blood vessels. Walnuts also contain L-arginine, an amino acid that the body converts into nitric oxide, magnesium to relax vessels, and even melatonin, which helps regulate blood pressure rhythms while you sleep. Essentially, you're giving your body multiple natural blood pressure lowering compounds exactly when it needs them most. Research in the Journal of the American Heart Association shows that regular walnut consumption reduces blood pressure by 5 to 7 points on average. Timing matters, though. Eating walnuts before bed has stronger effects on nighttime blood pressure than eating them earlier in the day. Raw walnuts are best, but unsalted roasted walnuts work too. Avoid candied or heavily salted versions. 1 ounce, roughly 14 halves, is enough to make a difference. If you're over 60 or already have blood pressure concerns, this is an easy, natural, and safe habit to add to your nightly routine. Don't let convenience or forgetfulness allow silent nighttime spikes to damage your arteries. A small handful of walnuts before bed every night could protect your heart, improve vascular health, and reduce the risk of stroke while you sleep. Next, we'll move on to the fourth strategy, which is a simple daily beverage that rivals prescription medications in its effect on blood pressure, yet costs only pennies per serving and is available at any grocery store. This one is surprising, safe, and perfect for seniors looking to lower their numbers naturally. Now, let's move to the fourth strategy, and this one is both simple and powerful. It involves a beverage, not water or coffee, something that contains compounds so effective for blood pressure that they rival prescription ACE inhibitors. Yet it's inexpensive, widely available, and completely natural. The research behind it is strong, and it amazes me that more doctors don't recommend it. Susan's story illustrates this perfectly. She's 69, had stage 2 hypertension, and was on maximum doses of 2 blood pressure medications. Her numbers were still 152/90, and her nephrologist was concerned because uncontrolled blood pressure can cause progressive kidney damage. Susan's kidney function was starting to decline, and time was running out to get her pressure under control. She wanted a natural option that could protect her kidneys and overall health. I told her about a specific tea she could drink, 3 cups a day, morning, afternoon, and evening. Susan had never considered tea as a therapeutic option, but she was willing to try anything that could help. 3 weeks later, her blood pressure had dropped to 140/84. 6 weeks in, it was 134/80. We reduced 1 medication dose. 3 months later, her readings were stable at 128/76, and we were able to reduce the second medication. Her kidney function stabilized, and her nephrologist was impressed. The tea is hibiscus tea, deep red, slightly tart, and available at most grocery stores and health food stores. It's more than a pleasant beverage. Hibiscus contains anthocyanins, powerful antioxidants that improve endothelial function. More importantly, it contains compounds that act as natural ACE inhibitors, blocking the enzyme that constricts blood vessels. This helps your vessels stay relaxed and open. Hibiscus also increases nitric oxide production, has mild diuretic effects without depleting potassium, reduces inflammation, and improves lipid profiles. Studies published in the Journal of Nutrition show that 3 cups of hibiscus tea daily lowers systolic blood pressure by 7 to 13 points in people with mild to moderate hypertension. The effects increase over weeks of consistent use, and the benefits can be comparable to first-line prescription drugs. 1 cup occasionally won't do much. Consistency is key. 3 cups every single day. Brew it strong, drink it hot or cold, and sweeten with stevia if needed. Avoid sugar because it can counteract the benefits. Hibiscus tea is safe, natural, and effective. It works through multiple mechanisms, improving endothelial function, relaxing blood vessels, supporting kidney health, reducing inflammation, and lowering blood pressure. For seniors, this is a low-cost, practical, and enjoyable way to supplement other lifestyle strategies. When combined with the strategies we've already discussed, vegetables first at every meal, apple cider vinegar with meals, and walnuts before bed, hibiscus tea provides another powerful tool to take control of your blood pressure naturally. It's easy to add to your daily routine, and the cumulative effect over weeks can be remarkable. Next, we'll move to the 5th and final strategy, which might be the most surprising because it involves stopping something many people think is healthy. Eliminating it can dramatically reduce inflammation and high blood pressure that sneaks up silently. This last tip will complete the set of 5 powerful strategies that seniors can implement starting today. Now, let's talk about the 5th strategy, and this one is perhaps the most surprising. It involves something you need to stop eating, something you may have been told is healthy and may even be using because your doctor recommended it. Yet, recent research suggests these foods could actually raise your blood pressure through a mechanism that was only recently understood. David, a 71-year-old, had blood pressure at 168/94 while taking 3 medications. He was careful, low sodium, lots of vegetables, daily exercise, but his numbers wouldn't budge. When I asked what oil he cooked with, he said, "Canola oil. My doctor said it was the healthiest choice." I explained that all vegetable oils, canola, soybean, corn, sunflower, can drive chronic inflammation that elevates blood pressure, and that switching to healthier fats could make a dramatic difference. We replaced his vegetable oils with extra virgin olive oil for low-heat cooking and salads, and butter or avocado oil for higher heat cooking. At first, David was skeptical. His doctor had recommended vegetable oils after all, but 4 weeks later, his blood pressure dropped to 154/88, 8 weeks later to 142/82, and 12 weeks later to 136/78. 6 months in, he was stable at 132/76 on just 2 medications instead of 3. His inflammation markers plummeted. CRP dropped from 4.2 to 1.1, and endothelial function improved 28%. Why does this work? Vegetable oils are extremely high in omega-6 fatty acids. Most people's diets have a ratio of omega-6 to omega-3 around 20 to 1, while the optimal ratio is closer to 1 or 2 to 1. This imbalance promotes chronic inflammation in your blood vessels, making them stiff, reducing nitric oxide production, and causing blood pressure to rise. By switching to fats that are lower in omega-6, like olive oil, avocado oil, or butter from grass-fed cows, you reduce inflammation, improve endothelial function, and support healthy blood pressure. For seniors, this is a simple but powerful change. It doesn't require a supplement or new gadget, just a mindful choice in the kitchen. Replace vegetable oils wherever possible and choose traditional, natural fats instead. Over weeks, your body responds, blood pressure comes down, inflammation decreases, and your risk of cardiovascular complications drops. Today, We've covered 5 natural strategies that can work faster than most prescription medications. Eating vegetables first at every meal, adding vinegar to meals, consuming walnuts before bed for nighttime blood pressure, drinking hibiscus tea 3 times daily, and eliminating inflammatory vegetable oils. These strategies empower you to take control of your health without relying solely on medication. This isn't about panic or stopping your prescribed medicines on your own. It's about knowledge and action. Use these strategies, track your blood pressure, and work with your doctor to adjust medications safely as your numbers improve. Your heart has worked hard for decades. It deserves this care. Before we finish, there's one important point. Even these strategies can be undermined by one common medication many seniors take daily, which can secretly raise blood pressure by 10, 15, or even 20 points. In the next video, I'll reveal what this medication is, safer alternatives, and a nutrient deficiency that affects over 70% of seniors, which when corrected can drop blood pressure 15 to 20 points within weeks. Start now. Pick one strategy with your very next meal. Eat your vegetables first, add vinegar, try walnuts before bed, or brew hibiscus tea. Track your readings and see the difference for yourself. These small, consistent steps are your path to safer, healthier blood pressure and a stronger heart.